Welcome back, everyone. May is Stroke Awareness Month. We are joined now by Marcus Braz, CEO of Health South Rehabilitation Hospital of Sarasota, and Doctor of Neurology, Tanya Stevenson. They're here today to talk about Stroke Awareness Month. Thank you so much for joining us today.
Thank you for having us.
Thanks for having us, Kathy.
Oh, of course. We should probably start off by asking, what is a stroke for those who don't know out there?
A stroke, I like the term brain attack.
Okay.
When similar to a heart attack, it's something that comes on suddenly and something that's very serious. About 85% of our strokes are from a blockage to a blood vessel. Either a clot travels to the brain itself or it forms in the blood vessel wall itself. The brain downstream doesn't get blood flow, and so it doesn't work. And if there's damage, there's a stroke. About 15% a blood vessel can burst or open up, and that's a hemorrhage. That makes up the other 15%. Again, it's sudden onset usually.
So sudden, then what are some of the signs that we're talking about? What are some of the symptoms or signs that you're actually having one?
There is an acronym called FAST that is very helpful. The F for face, you can see a droopy face. Okay. The arm, sometimes you can see an arm sort of drift down. Speech can be affected, and then the T could stand for time because we want people to go to the hospital. Some people will have sudden onset of dizziness or confusion, but usually it's something one side of the body or the other.
Okay. All right. So what can we do to sort of prevent this then from happening? What's prevention?
As you can imagine, there are some risk factors that we can't control. Our genetics, our age, but things like high blood pressure is one of the most important things. If you're smoking, try to stop. Stopping smoking after about 5 years can lower your risk of having a stroke as well as a heart attack.
Really?
Things like high cholesterol, diabetes, these are all risk factors. Some people have an abnormal heart rhythm, so just following up with the primary care doctor can also help to catch some of these before they become an issue.
So when they do become an issue, then what is, say, treatment like at Health South?
Okay.
Well, the treatment at Health South for strokes is very specialized and very individualized. Mm-hmm. It's specialized because we have specialty designation to treat patients with stroke. We're accredited by the Joint Commission accreditation with disease-specific accreditation to treat patients who've been affected by stroke. Additionally, we have specially trained nurses, physical therapists, occupational therapists, speech-language pathologists. And what's unique about our hospital is that they work in teams. So we have specialty teams that are strictly focused on treating stroke patients in our environment. The therapy is intense. They get 15 hours of therapy per week, and it's very focused on the individual functional needs of the patient.
So, so this is once someone has suffered a stroke or whatnot, you guys also work to sort of on a mission of creating, healthier lives, right, at your hospital. So how do you do that?
Well, we're very focused on community outreach. We partner with all the community hospitals. We work with the hospitals for support groups, stroke support groups in Sarasota, in Venice, in Manatee. We also do community outreach lectures with physicians, with clinical staff to help focus the education, as Dr. Stevenson mentioned, on prevention. How can we, this is a preventable occurrence in someone's life. So we really focus on medication management, high blood pressure medication management, pharmacy, and healthy eating and exercise, those types of things.
So and knowledge is so important, as we've talked in all these questions of knowing the signs, knowing where to turn to, and then again bringing it together with the mission of trying to create healthier lives so it doesn't happen in the first place. So this is just a wonderful way to get all this information out, and Stroke Awareness Month is again just something that you should take these tips and always keep them with you, because again it is preventable. So thank you guys so much for joining us today.
You're welcome. And if I could just mention one other thing. May is Stroke Awareness Month, and we're celebrating that by educating at our hospital May 31st. We have a lecture for women on stroke. Dr. Kinga Porter, please, the public is welcome to join us so that we can provide the education that's needed to our community.
Definitely. We'll get that information out there. Thank you guys so much for joining us today.
Thank you.
Thank you.
All right. Well, the Classical Music Celebration is this weekend. We have a preview right after this break.